Hi, this is Dr. Corey Maas on Looking Your Best. I wanted to take a few minutes today to talk about something that's gotten a lot of media attention, CoolSculpting. CoolSculpting is a newer technology and one that I'm recently become much more interested in as they vastly improved the technology in the last couple of years. When it first came out, I think it was a good device, but rather crude in its application, a little bit unpredictable even in some cases. And now with a lot of use and some improvements in the software, the technology, and even the applicators, CoolSculpting has become a reliable way for non-surgical reduction of bulk fat. The treatment itself, as I'll describe in a few minutes in a couple of our videos and a little PowerPoint presentation, is done with the application of a large, basically suction cup in the areas that are carefully marked where unwanted fat is. This can be on the abdomen, hips, thighs, outer thigh, and inner thigh. Many areas can be treated. We fit the applicator on, a large suction pulls the tissue in, and in a very selective process of cooling, fat cells are much more absorptive of the cooling than the surrounding skin. The skin is kept at a temperature that keeps it safe. The fat cells are brought down to a temperature where they basically fracture, lyse, break open, and they're no longer there. They're destroyed forever. The fat that's released into the tissue is taken up by macrophages and other inflammatory cells, and there actually is some tissue tightening associated with that inflammation. CoolSculpting is very comfortable for most people. There's a sort of an intense feeling of suction initially, but the cooling itself is got a numbing effect to it, and it's really just sitting and reading a magazine for an hour. I think the really important part of CoolSculpting is going to a center where there are two applicators available. You really don't want to sit there twice for an hour, hour and a half if you don't have to. If you've got love handles, both can be treated at the same time. The abdomen is treated with typically two applicators, one on each side, etc. If you have an isolated bump, you can certainly just use one applicator on one side. It's a bump of fat. And so almost everyone are candidates for this. As a trial, when this first came with the newer technology, and I followed this over the years as it got improved, I decided to be a patient to test it and make sure it worked. I did one love handle and left the other side untreated. I don't have a lot of extra weight, but this was an area where it was just resistant fat. And in fact, after 3 months, the fat love handle was completely gone. So I can speak as both a patient and a treating physician with it. The application is easy, it's same day, there's no downtime or recovery. There's a few little nuances that the Maas Clinic and Appearance Care Center do that I think improve the outcomes and actually speed the recovery and get the improvement faster. And if you come in for an appointment, we'll talk about those nuances because they can be quite important in getting the best result. As always, I'm happy to talk about this, CoolSculpting, and any other new technologies. We'll get into some more detail on my website at maasclinic.com and on drmaas.com. But please feel free to send a photograph if you have an unwanted fat area, a video, have a friend take a video. You can send a video of yourself if you like, whatever the best medium is, or just write me a question or give us a call. Happy to answer all those questions. And as always, we're excited to share this new technology as it comes out, or certainly the improvements on technology that's been around for a while. This is Dr. Maas on Looking Your Best, and if you want to find out a little bit more about it, freezeyourfat.com is a good way to look at it. It's freezurfat.com. That's freezurfat.com. A site where you can learn an introduction and even get an appointment for CoolSculpting. This is Dr. Corey Maas on Looking Your Best.